Let's start our investigation of the different types of medical insurance by looking at Medicare. This is a federally funded program, and eligibility is determined by the U.S. government. This is funded primarily through payroll taxes. So when you work and get a paycheck, your employer will pay 1.45 and you have to pay 1.45% of your income to Medicare to support Medicare for those that need it right now. Who can get Medicare? Well, it's persons 65 plus or disabled people who are eligible for Social Security disability benefits. Also those in end-stage renal failure. There are about 50 million Americans who are eligible, and it's estimated 60 million will be eligible for it in the near future. Medicare has 4 different parts, Part A, B, C, and D. Let's just take a few moments to look at the different parts and what they cover. Part A of Medicare is for hospital care, skilled nursing, home health, and hospice care. It's funded again through payroll tax. You may purchase Medicare Part A, but there's a premium of $458 a month. There's no premium required otherwise. However, there is an annual deductible of $1,408. What a deductible means is that the insurance policy itself will not actually kick in, so to speak, until you pay the first $1,408. After that time, the insurance will start to pay. There's also co-insurance. So what that means is that even after you meet your deductible, there's still a portion of the cost that you have to pay. With Medicare, if it's less than 60 days in the hospital, there's no additional expense. However, if you spend 61 to 90 days in the hospital, it's $352 per day. If you're in the hospital greater than 91 days, it's $704. So you can see how this motivates hospitals to make sure that patients are discharged within the 60-day limit so that the services will be covered. Part B covers medical expenses. So this is doctor care, preventative services, x-rays, diagnostics, therapeutic services. And there is a premium of $144 a month. There's also a deductible of $198, after which there's a co-insurance of 20%. So what that means is that I have to pay $144 a year to be covered on Part B of Medicare. If I'm covered, I still pay the first $198. After that, I'll pay 20% of whatever the charges are. Part C of Medicare pays for additional expenses, and this is often called a supplemental insurance policy. So if you want to stay with Kaiser or PPO or some plan that you currently have, you can pay some extra money and have that supplemental coverage. It extends the services that you're eligible to have, and it allows you these services at a lower cost. This is a newer part of Medicare, and there are a wide range of plans. There's a website where you can enter the medications that you take to find out which plan for Medicare Part D best serves your needs. The premiums will vary based on your income, and there's a $435 deductible in 2020. Again, there's co-insurance up to 25% until you reach a maximum of $4,020 in expenses. Then there's what's called the donut hole, where there is no coverage, or actually, there used to not be coverage. That's been filled in, and I'll show you a graph in just a minute that demonstrates this.
Expenses paid for services, the person only has to pay 5% of cost. Add what is called the donut hole in its Medicare Part D. If you look at this illustration, you can see in the far left there's number 1 and it says deductible. This is the time that the person has to pay the amount that their deductible is. Once they meet the deductible, the coverage begins and they pay only a partial amount in terms of the cost of the medicine. Once they hit a maximum, in this example it's $4,020, coverage stops and the person had to pay 100% of the cost for the medication until they hit catastrophic level, where catastrophic coverage would kick in and they would only have to pay 5% of the cost. This was very difficult for senior citizens on a fixed income. What do they do when they have a lapse in coverage because they're in the donut hole? The Affordable Care Act has gotten rid of the donut hole, and now coverage is consistent across the entire time until you reach catastrophic coverage. You pay 100% of the retail drug cost until you meet a $435 initial deductible. After that, you pay 25% of the retail drug cost until you hit your first limit of $4,020. Because the donut hole has been eliminated, you can see that in the third green phase, you're still paying only 25% of the retail drug cost until you hit catastrophic, where you pay 5%. This has been a tremendous improvement in terms of senior citizens being able to access the medications that they need for health.